I'm going to be doing a subcutaneous insulin injection, and for this the first thing I'm going to do is check my patient's records and make sure that they have an order. And it looks like they have an order in here for 30 units before meals, and it's half an hour before a meal, so we're going to go ahead and draw this up and give that to them. And so I'm going to check them arm, make sure it all matches, which it looks like it does. So I'm going to get my insulin needle, which is a 100 unit needle, and I'm going to check my medications. I'm going to look for cracks, breaks. If they're multi-use, I'm going to make sure that they have a date and a label on them and make sure that they're not expired. They expire within 30 days. Once I get my medication, I can roll them, and I can roll them for up to a minute here to make sure that the medication's dispersed. And when I'm doing that, I don't want to shake them, I just want to gently roll them. And then I'm going to wash my hands before I draw this up. I'm going to open my needle, and I have 30 units here that I need to get, so I'm going to drop 30 units of air. I'm going to clean off the top of my vial here. Clean both of them off here. And I'm going to insert this in and inject 20 units of air into my cloudy first. And then I'm going to inject the other 10 into my clear. And then I'm going to draw out my 10. And if I have some bubbles in here, I can tap them here to make sure. Get the rest of my insulin out of my cloudy one here. I have 30 units, so I'm going to pull that out and recap my needle. And once I get my medication drawn up, I'm going to have a second nurse check it and make sure that I calculated right and that I have the dose correct. Once I have that second check done, I'm going to go down to my patient's room. I'm going to identify them by either their name and birthday or 2 identifiers. I'm going to make sure that they know what the medication is, that we're giving them their insulin half hour before meals. It's the right time, you know, we have the right route, which is subcutaneous. We're going to give it, and we're going to either do in the bottom of the stomach, the backs of the arms, the tops of the thighs, or the tops of the butt back here. And I'm going to wash my hands, put my gloves on. I'm going to make sure they don't have any questions, or, you know, if they want to rotate sites where they last had it, double check with them. And then I'm going to pick the site that we're going to use. We're going to wipe it with some alcohol. I'm going to let that dry for a minute here before we do it. If we have a patient that is skinnier, we're going to go at a 45-degree angle. But if we have a patient that's bigger, we're going to go just at a 90-degree angle. And I'm going to uncap my needle here. I'm going to pick this site here. And I want to kind of pinch up a little bit so I kind of get a good spot there and insert my needle. And then slowly inject my 30 units. Once I get that all the way in there, and pull out my needle and recap it. And then I'm going to discard that in the sharps container. And if they have some blood, I'm just going to kind of use a swab here to put a little pressure there. And then when we're done, I'm going to wash my hands. I'm going to go out to my chart. I'm going to make sure that I document the site that was given, the amount that was given, the 30 units, and I'm going to make sure I put the time on there.